Ready to get started. Good afternoon, everyone. It's an honor to welcome you and to thank Governor Herbert for hosting what I believe to be his first virtual press conference. I'm Derek Miller, President and CEO of the Salt Lake Chamber. As we all know, many things have changed and our way of life has been transformed these past couple of weeks as the state and the nation has battled the effects of the coronavirus. Every leader is being put to the test, and we're getting a glimpse of what Utahns are made of. Each of us is learning to deal with social distancing, and we're discovering new terms like flatten the curve and flatten the dip as we work to stop the spread of COVID-19. As background, the governor appointed me to chair the Utah Economic Response Task Force and to assemble some of the most capable minds in the state to develop a plan of action. A plan that represents a culmination of work from business leaders, healthcare professionals, elected officials, and experts at the Gardner Policy Institute. Today, the governor is here to share that plan and its message that when Utah leads together, we will combat and mitigate the effects on the state economy while maintaining the important health imperative. Our first priority is to protect public health, but equal to that is the priority of protecting our collective economic health. Our colleague, Natalie Gartner, will share details of the plan, but I do want to let you know that it has three simple yet strategic phases. Each phase is flexible and affects the subsequent phase. Success in phase one will compound to faster success in phase two, and so forth. Our goal is to provide Utah businesses and our people with a clear path and specific steps each one of us can take to aid in the health and economic recovery. This is a grassroots economic plan beginning with small business owners and their customers who sustain our economy. We are concerned about the number of people who may contract the virus and become ill. We are also concerned that everyone is adversely affected by the economic challenges confronting us now. While some may suggest that there's a trade-off between either focusing on health or focusing on the economy, we know in Utah that is a clear, thoughtful plan covering the strategic phases of this virus will allow businesses and consumers to assess their options and then make smart decisions. This plan contains milestones, it contains benchmarks, all to monitor progress towards a flexible but measured time horizon. This plan also takes many factors into account, including economic stimulus. But we hope that as businesses and employees see the vision and light at the end of the tunnel, we will inject not just capital into the system, but confidence and perseverance. We cannot let this virus dampen our culture of cooperation or the business climate by creating a culture of paralysis and fear. As we collectively lead together, we can help people preserve their economic stability by making payroll and maintaining jobs, as well as maintaining a spirit of unity throughout this challenge. The virus expands, we will adapt to its risks, and through innovation, we will overcome its challenges. The history of Utah shows that we are at our best when facing adversity. After all, we are the beneficiaries of a legacy that turned a barren desert into the most powerful state economy in America. It is part of our history, it is part of our heritage, it is in our DNA. And this plan that we have put together will allow all of us to put that heritage into action and to turn an economic setback into an economic comeback. Governor Herbert, we want to hear from you first, and following the governor, we'll hear from Natalie Gartner, who will provide an overview of the plan. We'll hear from Steve Starks, the CEO of the Larry H. Miller Group of Companies, and also Lavanya Mahate, the founder of the Saffron Valley Restaurants. Finally, we'll have the opportunity to hear from our State Senate President, Stuart Adams, and the Speaker of the House, Brad Wilson. Governor, we'll go to you.
Okay, well, thank you. We're having a little video difficulties here at the Capitol, but we'll get it worked out. Thank you, Derek, for that introduction. And certainly I want to welcome all who are going to participate today. It is truly my first virtual press conference. So, Derek, you called it right. We appreciate the members of the media that are here, hopefully helping us to get the word out to the people of Utah, separate fact from fiction, and make sure that we understand that really there are two quests here for us. Again, has been identified. The first and primary quest is to help protect the health and safety of the people of Utah. That's a primary directive for government. But secondly, we also have a responsibility to make sure we have economic opportunity. And these two items together. You can't do one without the other, and that's part of what we will be discussing here today. I believe that these are uniquely challenging times. I know for many of us in our lifetime, we've never seen anything quite like this at all. Maybe some similarities, but nothing quite like what we're facing here with this coronavirus pandemic that we're facing now. The plan that we have today called Utah Leads Together, and we'll talk more about that as we go through the presentation here today. Let me just read from the first part of the pamphlet here, the booklet. It says, the Utah Leads Together Economic Response Plan recognizes the value of facing uncertainty with a dynamic, data-informed, and unified plan. It gives structure and order to what can otherwise be an unclear and difficult reality. The plan conveys three phases of response: urgent, stabilization, and recovery. These phases will help businesses correctly balance the health of employees with planning imperatives necessary for continuing operations. In other words, the economic opportunity that they want to, in fact, have as they go forward. And yet they're concerned about their employees also. And the time estimates of the phases will give businesses the ability to set concrete objectives during a period of uncertainty. The time horizons give employees of those businesses confidence for a return to normal work and household patterns. Stability from directionally correct plans forms the basis for economic recovery and a return to normalcy. So the plan we have here is not any kind of guarantee, but it's certainly our goals that we can achieve, and I believe gives us a pathway forward for success in our state. This, by the way, I should mention, is a continuation. This is not something we've just invented today. This is a continuation of our effort for the past number of weeks. We've had the opportunity to, in fact, start a task force March 2nd, chaired by Lieutenant Governor Spencer Cox, who's done a great job with that task force to help address in the beginning, as this started to spread here to the United States and started to come into our state. Then on March 16th, as you've mentioned, Derek, already, we had the Economic Response Task Force. These two committees have been working in tangent together, again, to find a pathway forward where we can, in fact, do what we need to do to stop the spread of this virus, so that we recover. I mentioned too that comprehend of any state, any bright people, the best in business leaders, small and large businesses, given a chance. There's been a lot driven. This is we'll hear from the president today, from the state government, close governments, and their concerns and how we're them. This is overall comprehensive plan, which, as I mentioned, is the best of any state in America today. This is not my plan. I want to mention that, even though my name's on it. This is our plan. And this is something we all need to own and something we need to work together on to make it go forward. This is an action plan. And I'll just show it here. This action plan is for all of us, in fact, to read, to understand, and to know about, and recognize that we all have a role to play. We all have responsibility. This plan will only work if everybody participates in a united effort. If we don't, if people do and kind of ignore it, then this will not be as successful in stopping the spread of coronavirus here in the state of Utah or have a quick return to economic viability. So again, I urge everybody to read it and to understand it and then participate and fulfill your role and obligation as a Utahn to make sure that this is implemented. For those who want to know where to get it, we're going to distribute this at wide distribution across the state. This is a work of this past week. We've had people 24/7 working around the clock to do the deep dive analysis, to develop different models. This is not something we're just guessing about. This is something that's been very methodical over the past week to come up with what we are releasing here today, again, as a continuation of what we've been doing for the last 3 weeks. If you want to read it and understand it, go to coronavirus.utah.gov. Coronavirus.utah.gov. It'll be online. We'll have hard copies available for many people. We're going to produce those. We want everybody to read it and understand what their responsibilities are under this plan. Now, let me just conclude with a couple of things. One, there's good news. The number one effort of good news, I think, is that, in fact, testing, which has been the big bugaboo for everybody across the nation. They can't get enough testing kits. They've not been able to test enough. We've been working on this for a number of weeks. And last week, we were doing a few hundred a day. I'm pleased to announce that yesterday, we did 2,625 tests were done. We're continuing to ramp up. We hope that number continues to grow with additional capacity so that people that have symptoms, every one of those should be able to get tested. If you have symptoms, talk to your primary care doctor, get a referral, and you're going to have an opportunity to be tested. Now, if we continue to ramp up, we'd like to be able to have everybody be tested, but right now we still have to prioritize those who have got COVID-19 symptoms first. Other good news is, not only are we ramping up and having more tests, but we're making it available thanks to Intermountain Healthcare and others. We'll have 19 new locations where people can drive up and get curbside service, drive-through opportunities to be tested. We appreciate the fact that the University of Utah has opened up 4 more locations with their URUP organization, which is doing the bulk of the testing we're having in the state now. We appreciate their good work, and people are stepping up. This testing program is the most aggressive plan in the nation today on testing and tracking. We ought to mention too that it's not just testing, it's also being able to track down more where people that have this infection, we can isolate those we need to do. This stratagem, being able to isolate those who actually have the infection, is going to help us with a strategic application to not only isolate those who have the infection, but also gives us an opportunity to free up those that don't have it to re-engage back in the economy. So as I mentioned before, stopping the spread of this virus and economic development of the state of Utah are tied together. We need to get them both right so that we protect the health of the people and have the economy to start to recover, which I think under this timeline we've got in our plan here will give us all hope and optimism as we go forward. Now, there's some sobering news. This is just to give you an FYI. Again, as we do more testing, the numbers that we find of those infected will go up. That's because we have people out there in the community that are infected. They may not know it, but they're infected. And so we're going to track those down. And as we have more testing, we're going to find that those numbers will go up. But again, that's not altogether bad, because that allows us to actually do something strategically with those who need to be isolated and separate them from those who are not infected. And again, help us go on the road of economic recovery quicker and certainly more effectively. Again, let me just close by saying this. Let me reiterate, this is the work of many minds, many people working for the last really nearly 3 weeks with a deep dive on analysis and modeling and looking what's happening in other states and what has happened in other parts around the world. This is the most comprehensive plan to stop the spread of the COVID-19 virus of any state in America today, and that will lead us to economic recovery sooner than later. I'm very optimistic about it, and I'm very hopeful. As we come together, as Derek has mentioned, it's really part of our legacy and our heritage that we do work together. This should not be politicized. This is a matter of us all working together bipartisanly, helping to find the right pathway forward. Again, if you go to the coronavirus.utah.gov site, there will be an opportunity if you've got some suggestions, some recommendations. We certainly want to hear from people out there. And if there's room for improvement, we're certainly happy to do that. There's no pride of authorship. We're trying to find a solution to a significantly important problem. So again, I feel like we can be confident that we're getting on top of this and that we're moving in the right direction. And as we work together, that's going to help us. Last but not least, I am very optimistic about the plan and its application to what we have challenges here in the state of Utah. What gives me though hope and optimism is what I see the people of Utah, how they're conducting themselves. Doesn't mean we don't stumble and make mistakes along the way, but we have more and more stories of people in Utah helping their neighbor, acts of kindness, acts of sacrifice, coupled with sacrifice and kindness, helping people that need help. We know that there's those who are most vulnerable in our society, those who are shut-ins, those who are elderly. Please look for opportunities to help them weather the storm also. And as we work together, we are in this together. As we work together, we're going to find together the solutions that we need to over the next few weeks and few months to get us back to where we were before this virus hit us. So I hope that we'll all take that advice to heart, find ways to give service as we sacrifice. Together, this state will continue to be the shining example that this country needs of a successful state. So thanks to one and all. Now I'll turn it to the next speaker. I think it's Natalie.
Thank you, Governor. Appreciate the message. I'm Natalie Gartner. I'm an Associate Dean at the David Eccles School of Business at the University of Utah. I also direct the Kim C. Gardner Policy Institute and was asked to be the policy lead for the Economic Response Task Force. We have spent the last several days in intense work sessions to help create a plan that provides Utah businesses and residents clarity and specifics about Utah's plan for a health and economic recovery. I want to preface the plan by saying that there is a consensus among the economic community that the most important economic step we can take is to abide by the health guidelines that have been put forth by the state. We have an opportunity over the next several weeks to get on top of this problem and get out of what we would call an urgent phase. But it takes incredible vigilance, and people have to step up and do the right thing. I also, before I put the plan up on the screen, want to highlight that we view this plan as being a version 1 of what will be a dynamic and data-informed, unified plan, economic response plan for the state. And it will be dynamic and data-informed is because of the testing that is now ramping up in our state and can inform our economic actions. The last thing I'll say before putting up the plan is that there is a strong sense that if we provide a directionally correct plan, that Utah businesses and households around the state will be able to plan their lives with more clarity and certainty, and that in and of itself will help with our economic response. I would now like to call the plan up on my screen, and I realize some will be able to see that and some will remind people that coronavirus.utah.gov, you can get your own copy. You're seeing the plan on your screen. Great. The governor mentioned, Eric.
We can see it.
Okay, perfect. So I'm just going to kind of walk through some highlights of the plan. You'll see prepared by the economic response team. We recognize on the front cover that it's dynamic and that it will change. We label it as version 1 because we expect to be additional versions as we work through this. We call it Utah Leads Together, and the goal, which I'm highlighting right here, is that it provides Utah businesses and residents with clarity and specifics about our plan for a health and economic recovery. To be successful, we have to do these 3 things that are highlighted right here: rigorously follow public health guidelines and measure transmission rates, stay engaged with the economy, and assist those in need. One of the major innovations of the plan is to actually provide a stepwise progress of phases. We define these as the urgent phase, the stabilization phase, and the recovery phase. The urgent phase, we are in that right now. It started on March 16th and is expected to go for 8 to 12 weeks. Adherence to this phase will shorten other phases and accelerate our economic recovery. The stabilization phase would follow. We expect it to last 10 to 14 weeks. And the recovery phase would follow that and last 8 to 10 weeks. In the plan, we provide a lot of specificity on each of these phases. I'll just highlight that since it's all based on public health measures, we have a whole page in the report on testing, measurement, and advancing medical treatments. And we also highlight in this Protect the Hive our obligations as citizens to be a part of protecting our state. In the urgent phase, we have what I'll just call public health characteristics, economic characteristics, and public and private solutions. This is a serious phase. It's an urgent phase. If we adhere to it, we will be better off in the other phases, but you can see outlined on the left in the plan all of the public health practices that the state has asked us to abide by. Then you can see the economic characteristics next to it and the public and private solutions. I will highlight a couple of the economic characteristics. If you note at the top of that column, it references that the Utah economy is open and operating in compliance with specific public health practices. And then the plan lists every single industry in the state as being open, with some industries operating under specific restrictions. And we know that to be the food service and restaurants, personal services, entertainment venues, arena sports, arts, and bars. But I highlight this to recognize that this plan tries to find the balance between our health recovery and our economic recovery. And it does that by leading with health recovery, but recognizing that with careful public health practices, testing increases, contact tracing, and active monitoring, we can work through this. The other part I'll highlight on the urgent phase is all of the things being done at the federal level, at the Federal Reserve level, at the state level, the local level, and the private level to provide the economic guidance and assistance and leadership that we need to move out of the urgent phase. And you'll see a lot of those things highlighted there. Detail about the work plan for the urgent phase is provided here. The urgent phase is being Office of Management and Budget. They have created are working through the health measures and the operational to give us good guidance as we move through these phases. I'll highlight now 10 to 14. We expect to begin to slow. I should to this phase for 1 minute. It's the measure that we're tracking COVID-19 rate of 1 at the beginning of this phase to 1.0 by the end to progress to this stabilization phase. Stabilization phase you see of public health characteristics is that we believe the monetary and fiscal policy is being worked on nationally will start to take effect, helping small businesses, helping highly impacted industries. It's also a phase where the medical research and vaccine might start to show some promise. There'll be cash infused into the economy. And I'll just mention that our state, all of the work that we've done to be a fiscally prudent state begins to pay off because we have set aside resources to help us during these phases. In the recovery phase, we expect that to last 8 to 10 weeks. As we have the virus growth commences, you'll see the measure here is that the COVID-19 transfer rate approaches near zero. The last thing that I will highlight is that we have put in this plan the things that the Utah business leaders and employees can do to stay engaged with the economy. And we list general guidance in specifics. We list guidance by specific industries to tell businesses what you can do to operate safely. And we provide resources in this owners and employees that you see here. And then finally, in the data appendix, we provide the information to help people know what are we talking about when we say we have fiscal stability in this state, where we have budget reserve accounts and working rainy day funds and an unemployment insurance trust fund that's at record levels. And we've built, we have an unemployment rate that sits at 2.5%. These are all things that will help us as we go into the restoration of our economy. We also list the actions of the Federal Reserve and what we think might be the likely fiscal. And I'll just everyone that an amazing economic response, which you and an industry which you see that has helped with this plan. I am optimistic that will provide needed certainty and clarity of direction. It is a dynamic change based on the health measures, but it does provide a plan around. And with the time back over to
We'll now go to Steve Starks.
Thank you, Derek and the governor. The privilege for us to participate in economic recovery, chance to share more about how we're putting and best throughout the Larry H. Miller Group. First, we fully endorse the plan that's been outlined today. It is a privilege to work in a state that works well together when challenges arise. I applaud our state business community, from small family businesses to Silicon Slopes, our healthcare experts and others, for having the foresight to build a plan that helps to set expectations and gives specific action items to help us not only weather this storm, but to protect and recover as quickly as we possibly can. Currently, the Larry H. Miller Group is working through this urgent phase that Natalie talked about. As you know, concerts and jazz games are currently postponed, and all theaters are closed. We have worked on an innovative solution through the Department of Workforce Services to connect our part-time employees currently out of work with employers who have temporary workforce needs. We encourage other businesses to connect with DWS so that we can rapidly bridge the gaps and keep people working. And like many other parts of the economy, there are also parts of our organization that remain open for business. Our automotive dealerships, as an example, continue to provide service and sales departments to ensure our critical workers and the public have safe and effective transportation to get to work, to the store, and to the necessary healthcare facilities that they may need to go to. We have implemented sanitization and social distancing measures to keep our customers safe and are providing free concierge services to pick up and drop off those who may need assistance. As we all should, we are following the recommendations in the plan that Natalie just outlined closely, including providing work from home opportunities for as many of our employees as possible. Health and safety of our employees is our first priority. I would also like to encourage those working in all aspects of our economy to continue to work wherever you can, to innovate and to find new solutions. We know that necessity is the mother of invention, and as we emerge from this global event, Utah will come back more unified, innovative, and stronger. And we all know that the Utah Jazz will be back on the court, that the Bees will be back on the field, and that families will enjoy sharing a bucket of popcorn while watching a movie at Megaplex theaters or their theater of choice. Lastly, we need to support each other during these challenging times and appeal to our better angels by looking to help those around us. Social distancing can't become human isolation. We need collaboration and coordination rather than contention and finger pointing at all levels. Our community has faced challenges in the past, and as we work unitedly, look to do good in our individual circumstances, and follow the recommendations outlined today, we will emerge from this a stronger and more united community. Thank you.
Thank you, Steve. And now we'd like to go to Lavanya Mahate. Go ahead, Lavanya.
Hello.
I can hear you. Go right ahead.
Sorry about all the technical difficulties with the video. Hopefully you can hear me. Thank you, Governor. Thank you, Natalie. Thank you, Derek, and all the other leaders on this call. My name is Lavanya Mahate, and I'm the owner of Saffron Valley Restaurants and Catering, located across the valley. Yesterday, I was very heartened by a call from the Salt Lake Chamber. Heidi Walker reached out to me and inquired how our business was doing and how I was doing. And I replied to her that we've never seen anything like this before, but we will emerge stronger and kinder. Today, I'm here to support the governor's plan, Utah Leads Together, as it provides a roadmap to recovery. I know many leaders have worked tirelessly to put this together, and I want to thank you for your help, your guidance, and your leadership as we all try to find answers and navigate through this difficult time. And we are still open for business and finding creative and innovative solutions for curbside and delivery. And as things change, we will do our best to serve our customers, keeping in mind the highest public safety standards in mind, according to the state and the Salt Lake County Health Department's guidance. And we invite you to support us and all other small businesses in the state. And I am sure we will get through this together, stronger and more kinder. Thank you for the opportunity to be on this call.
Thank you, Lavanya. We now have the opportunity. President Stuart Adams. President Adams, go ahead.
Thank you, Natalie, Steve, Speaker Wilson, and all those that are on this conference video. But I also would like to thank those that have done so much to put this plan together. There's been a lot of effort. I'm really proud to be an American, to be part of a society where business and government and everyone actually comes together to try to find a solution. What we're trying to do here is save lives. And lives can be saved in a couple of ways. One is we can save lives by actually following the items that have been outlined in this plan: social distance, sanitize surfaces, actually try to do the things, wash our hands, that we've all been told over the last few weeks. But we can also save lives by trying to reduce the burden on our healthcare professionals, those in our healthcare industry. And that can be done again by trying to social distance and follow this plan, but it can also be done by finding ways for treatment. And it's kind of exciting. We've discovered, and there's been a lot of work done on different treatment procedures, but there's an 80-year-old drug. It's called hydroxychloroquine. And that 80-year-old drug can be basically off-label prescribed by doctors today. But as we've looked at it, it may have some potential. And today, our Department of Health Director, Dr. Miner, has actually issued a standing order that allows physicians to prescribe that. Now, hydroxychloroquine won't cure this virus, but it may actually suppress the respiratory problems that are caused by COVID-19. And if it can do that, if it can do it before people go to the hospital, it will bend that curve, actually reduce the number of people coming into the hospital and bend the curve of the demand on our healthcare professionals and allow them to take care of those that are really sick. So it's exciting, like I mentioned before, to be part of this process, to see private industry, to see government leaders, to see people actually use their resources and try to do their best to solve this problem. This is a great plan. I support the plan. And I believe if we follow the outline of this plan and actually find a way to treat it, that we can do two things. We can save those lives, but we can also save our economy. And I think we can do both. Thank you.
Thank you, President Adams. Thanks also to Speaker of the House, Brad Wilson, who's joining this virtual press conference. And Speaker Wilson, we'll turn the time to you.
Thank you, Derek. It's great to be with everyone today. Good afternoon. Our Our global community is experiencing something that's just unprecedented. And our response to this challenge as a state must be equal in measure to the threat that this virus poses to our health and our economy. I believe it's going to require not just our best thinking, but our best planning and our best efforts to successfully weather the crisis that we're experiencing right now. But we are all in this together. To be successful, we're going to need to work together as never before. As has been described by a number of folks on this video conference, the aim of this plan is to do three things exceptionally well. Follow the health guidelines in the plan, remain engaged with the economy, and assist those in need. And I believe these three things should become the goal of every Utahn. The plan presented today is the product of dedicated leaders in government, business, and our healthcare industries who've been working tirelessly to solve this problem in our own Utah way. But the truth is, leaders cannot solve this challenge on their own. This plan is only going to work, Derek, if all Utahns are committed to making the necessary sacrifices in the short term to reduce the duration and the intensity of this challenge as we move through the urgent stabilization and recovery phases over the coming weeks and months. The next 10 days are really critical, especially critical. We cannot have lapses in judgment over the next 10 days as we work to contain the spread of this virus. We need to identify and protect our vulnerable populations, and we need to safeguard our state's economy by being very aggressive over the next 10 days. The goal is for every Utah community, every neighborhood, every block, every family, and every individual to stop COVID-19 as fast as possible by flattening the curve. There will be more infections and unfortunately possibly more deaths in the state of Utah in coming days and weeks. But if we can get everyone focused on this life or death objective very quickly, the devastating impact on the lives of Utahns and our economy here in Utah can be dramatically limited. Since the focus is clear, we must now do the things that are required to win as Utahns, the things that can give us leverage against the virus. Leverage acts as a multiplier. It provides a mechanical advantage, and it can make our work a lot easier. Experts, including some on this call, have identified and relentlessly communicated the levers that will flatten the curve here in the state. Wash your hands with soap every hour for 20 seconds. Cough in your sleeve. Stay home and don't allow visitors. Practice social distancing if you must leave your house. Self-quarantine for 14 days if you're exposed to someone that has the virus. Families can limit their trips outside of the home. Offices that have people in their facilities can do more of those meetings through Zoom or other electronic platforms. And we ask businesses and employees to check for any signs of illness before they go to work each day. And all the other elements that Natalie described earlier in the plan. Despite the unique challenge that COVID-19 presents to Utah, I am really hopeful and optimistic about our future. Utah's house is absolutely in order. I have faith in our community leaders and our healthcare leaders and the individuals and families who make up our state. Utah is very strong. So, Derek, as we stand together as Utahns, let's just make sure that we're not 6 feet or closer to each other. Thank you.
Thank you, Mr. Speaker. We now have a few minutes for questions from the media who are joining this. And the first question is from Rick Aaron from ABC4. Rick, go ahead. We should be able to hear you now.
Hey, thank you very much. This is a question for the governor. With 13 states now implementing mandatory shelter-in-place orders, why hasn't the state of Utah taken this step?
Well, thanks for the question. We see a lot of different approaches throughout the country, and that's the individual states and the regions that have different approaches, and they have different circumstances and situations. I don't think we're to that point of having everybody quarantined to their home. We still are looking at people implementing social distancing. We still have in place no larger groups than 10. We still have the challenge of in-house dining. We're looking to those out there involved, particularly in the private sector, to see if there's other ways we can accomplish the same thing. with some best practices, which we certainly want to hear about, and see if there's variations on the same theme that we can address, which will help us keep the economy going. Again, it's a balancing act of we want to protect the health and welfare of the people, and yet we want to make sure that the economy doesn't completely tank either. So they're both joined together. We'll be reviewing our restrictions that we have in place today. We'll be doing that ongoing. There may be want to talk about days or back to you on those.
The next question is from Carter Pape from the Times Independent. Carter, we should be able to hear you now.
Can you? Yes, sweet, awesome. So yeah, my question is just whether about this pandemic impacts a lot of different industries and businesses. Tourism in particular is relevant to our audience in Moab. So my question is just whether this plan includes any guidance specific to Utah's tourism destinations, such as Moab.
Natalie, do you want to address that question, whether the plan talks specific to tourism?
Yeah, happy to do that. It certainly does. I mean, we're in an urgent phase, and the plan does identify industries that are hardest hit. The travel and tourism industry is among those, as are restaurants and entertainment, cultural, and others. The plan outlines economic measures that are being taken to minimize the hurt, to minimize the suffering, and some of those are still playing out. And so the message, I believe, to the tourism industry is that Utah has a plan. It recognizes that we're in an urgent phase. We have both fiscal, monetary, and state and local remedies that we're working through. We also have private sector remedies, right? So restaurants are a big part of the tourism industry. We can do dining from the curbside. And you're going to see a lot of innovations coming out of the private sector as well as the public sector as we work through this. But there's no question that this particular economic shock is hitting some industries harder than others. And this is part of the call for civic duty for all of us to find ways to stay engaged with the economy, help those in need, be a part of the solution.
Thank
Derek,
you, Natalie.
Derek,
Go ahead, Governor.
And let me just weigh in on this issue. One of the reasons why Utah has been the most successful economy, most diverse, certainly in the country, is because of our global nature. We do a lot of international business. We've increased tourism dramatically, double digits per year the last 7 years. And where this has been kind of a global problem, people have ceased traveling. Whether there's been restrictions or not, people are afraid. And so that's had a dramatic impact on what's happening not only in our state, but other states as people don't travel as much, as we all know. We also have mixed messages. We have people in some parts of rural Utah that want us to shut the state parks and the national parks and are saying we don't want tourism to come because we don't have enough bed space and other issues that they're concerned about. We see where Hawaii now has invited people not to come because of their efforts to stop the spread in Hawaii. Again, we have others who are saying we in rural Utah need to have tourism and travel, and what can we do to promote it? So we're caught in this catch-22 a little bit, but we're impacted mostly by people's own desires to be safe and to not travel and not go into crowded places. So we're going to be working closely. I'm not a one-size-fits-all guy traditionally. We've had some that want to think that everything should be the same, no matter what city you're located in or what county you're located in. We don't know if that's necessarily going to hold. We think that there may be some opportunities for flexibility. That's yet to be determined. Again, the hospitality industry and tourism and travel are the hardest hit of all. And we want to see if there's some way we can eliminate that hardship. And so we're looking for ideas and opportunities that maybe we have not explored or understood yet. So please, those involved in this area of our economy, please weigh in, let us know what your best practice ideas are and see if we can find a solution.
Thank you, Governor. And I would also add that in the section of the plan that Natalie Gartner referenced about best practices, there's also a link in that section to a very thorough vetting of industry best practices, one industry at a time. The Economic Response Task Force has formed many committees, one of which is a committee dealing with industry groups, of which there are dozens. Those dozens of industry groups represent thousands of Utah businesses. That's the process by which they have been developing their own best practices to stay safe and to stay open. Our next question is from Dan Rascon from KSL TV. Dan, go ahead.
Thanks a lot. I appreciate you taking my question here. We've had dozens of complaints from employers saying their workplace isn't safe, employer isn't letting them get people, maybe letting them work from home. The conditions at the workplace aren't good. They're not taking COVID-19 very seriously. Is there any kind of action these employees can take, or is there any kind of enforcement by the task force against these employers who maybe aren't taking COVID-19 very seriously and employees don't feel comfortable going to work?
Governor, do you want to address that question, if there's a consideration of actions that would be taken?
If employees have issues, certainly they could talk to the Chamber of Commerce. Derek and your cohorts are the voice for business out there. Our Workforce Services Department, headed up by John Pierpont, is taking a lot of calls to help people that are unemployed to get on unemployment insurance, to help them if they need retraining, reskills to get a new job. We actually lead the nation when it comes to people that are unemployed getting back to work. That will play a significant role as we have this downturn right now currently to help people get back up to speed and get a job. We also have programs for the employer. Clearly, if the employer needs some help, again, we'll see what comes from Congress if they can pass this authorization act to help with businesses. I hear up to probably close to $2 trillion. Half will be for employees and help healthcare, and some will be to help with businesses stay afloat with small business loans, SBA loans, which will be at low interest or no interest, grants that will take place. So we're going to be in kind of uncharted waters here and unprecedented opportunities, particularly for the federal government to step up in conjunction with state and local governments. If there are complaints, call our constituent service line. That's area code 1-538-1000. We're happy to help refer you to where somebody can give you some answers to questions or to give you help if you have some complaints. So again, I think most out there are working very well and being honorable in how they treat each other. The uncertainty, it's a little bit fearful out there. We understand that, but this is a time to have, as has been mentioned earlier, the best angels of our nature come out.
Our next question is from Ben Winslow with Fox 13. Go ahead, Ben.
Sorry about that. My microphone there. They said that he would every thing Easter, based upon at least an initial scan of your plan, it looks like that's not in your plan. So Governor or Mr. Miller, I'd like you to just address, kind of what the president is seeking and what Utah is doing based upon this plan.
Let me just try the first part of this, chime into and speaking for business. One, I hope back to normal by Easter too. And that would be a miracle if we could do that. And I believe in miracles, so maybe it'll happen. We are basing our timelines based on deep dive analysis. This is not something we pulled out of the sky. This has been the work of many very smart people over the last week. Like I say, the last weekend is like 24 hours a day to do the analysis, the models, and see what we think is realistic. We don't want to under-deliver, over-promise and under-deliver. We think this is a realistic timeline that you can count on. Again, particularly if everybody participates, we think this is realistic. If things happen more rapidly than that, great. Certainly we want to emphasize that Utah is open for business. We understand the hospitality industry is the hardest hit right now, and our heart aches, and we all miss the socializing that happens and eating at restaurants and having a good time. We hope that part changes soon. But for a total going through the urgency, then the sustainability, and then recovery timeframe, we think is going to take probably closer to 2 to 4 months to have that to happen.
As the governor mentioned, there's a time frame, a range associated with each of the phases. The first phase being 8 to 12 weeks. We're going to drive hard to that 8-week goal. And I would just add that the business community has taken on the mantra, adapt, innovate, and overcome. And through the adaptation and through the innovation, we may need to make game time adjustments. We may need to make a halftime adjustment. But business can do that based on the circumstances that we face today.
Derek, can I just add, this is Speaker Wilson, that I think to Ben's question, really to some degree, the speed with which and which holiday we're celebrating when we move from the urgent phase to the stabilization phase is largely in the hands of Utahns at this point. And so if we want to get closer to Easter than Cinco de Mayo, well, let's take the urgent phase real seriously. And if we want to extend this to Memorial Day, we can maybe be a little bit more lax. And to something that I said earlier in my comments, the next 10 days to 2 weeks are the most important for us in terms of our ability to get momentum in the right direction. And so everything we can do over the next 2 weeks will set us off on the right course.
And Derek, this is President Adams. I don't know if you can hear me.
I can hear you.
But I maybe add to that we now have a quantifiable plan, and we can measure our performance based on this plan. And if we do better, we can shorten it, as the speaker indicated, and hopefully we'll have things that we can add to it that shorten it and allow us to move through this faster. But we have something to compare to and a goal that's been set. So I think that is what is the great thing, and I think is one of the more exciting things of this plan, is we have quantifiable measures that now we can see how our performance relates to these goals and measures we set.
We have a question now from Jacob Klopfenstein from KSL. Go ahead.
Hi, yeah, thanks to all the panelists today. This is a question for Governor Herbert. Obviously, you know, there's been a lot of rumors out there during this time. One of them that I did hear recently was that there might possibly be restrictions on driving, or that you might need a pass of some sort to go out on the roads and drive on the roads. You know, I don't expect that there's any truth to that, but can you clarify if that's anything that the state is looking at this point in any capacity?
Well, Jacob, thank you for the question. Clearly, we know that what we need to do is quit interfacing with those who have the COVID-19 virus. The challenge we have is we don't know who's got it. Hence the need for more testing. That's why we've been working on this diligently for 3 weeks. And again, the rest of the country's had the same problem. Fortunately, I think because of our efforts we've done the last couple of weeks, testing is going to increase, and that's going to help us understand who has the virus and how we can isolate them and keep others away from them. Again, self-isolation, again, the common sense things that the speaker just mentioned that we've been talking about for weeks, particularly for those who are most vulnerable, the older population, those above 60, ought to be staying home. They ought to have an abundance of caution, be extra cautious. If you have health issues and you're older, that's a double whammy. So even more for them to stay home and self-isolate and not get out, where they might bump into somebody that we don't know that has the COVID-19 virus. So that being said, all things are on the table. We'll take a look at what we need to do. We hope we don't have to have those kind of draconian efforts to help us to do what is mostly for us common sense and the isolation, the social distancing that's necessary. And we hope we don't have to take more draconian steps. But those are certainly things that we're seeing in other states. And we hope we don't have to get to that kind of lockdown stage.
We have time for just one last question, and that will be from Tony Semerad at the Salt Lake Tribune. Tony, go ahead. Tony, can you hear us?
Yeah, I just unmuted. Sorry about that.
Go ahead.
Thanks, everybody. There are so many ideas in play at the federal level for economic relief. Are there key items in that relief package in terms of this Utah plan? That is, which of those do you consider most essential at this point for recovery?
Governor, do you want to take a shot at what you think is most essential? And then I'd be happy to comment as well.
Well, I think there's enough that there's just essential when it comes to the citizens. One that has, and maybe shorten the length of time and the severity of the COVID. That shows we've got that. Hopefully that'll be able to be to those infection. So medicines, I expect there will be a vaccine that will have a project going. They should have to have the development of a vaccine that we can use against the COVID-19 virus. So the healthcare is not one thing. What's coming out of Washington, D.C. also, though, is the ability to help our businesses, SBA loans, grants, the ability to bridge the gap for those who are struggling over this next 3 or 4 month period of time, helping them stay afloat and helping them keep people employed, working in tandem. So I hope that we're working on both planks from Washington, D.C., efforts on a Manhattan-type project for vaccines and for medicines. And secondly, that we'll have some help. Again, I would argue, as I've mentioned to the president and other governors agree with this, block grant some monies to the states. We know best in our own unique backyards where we could place that money to get optimal effect. And so I hope that the federal government, not just writing out checks and having FEMA show up on our back door, we're better than FEMA. And so I'd prefer to have the money come, let us disperse it as we see fit, which will help give relief economically and to help those that are in need. Those are my ideas.
Thank you, Governor, and thanks again to all of our speakers and all who joined this press conference. Remember, this plan is a call to action for all Utahns. And also remember that what we're talking about today is people. We often talk about plans, we talk about the economy, and we even talk in terms of jobs, but what we're really talking about is people and people who need the help. Please also remember that this is a living document and we want your feedback. You can find and share the plan as well as comment and engage with us to help us make it better at coronavirus.utah.gov. Thanks.